Hi, Allie. My name's Alex. I'm one of your OTs today.
Nice to meet you.
Nice to meet you. I'm here to talk to you about carpal tunnel syndrome, since I heard you've been having some difficulties.
Yes, I've been having a lot of tingling and pain in my hand, especially when sleeping.
So, carpal tunnel is a condition where the median nerve at the wrist undergoes irritation or is compressed, and other health problems and possibly repetitive hand motions can contribute to this condition. And so if you can see on this diagram right here, this is typically where the compression site is and the nerve distribution. Often you feel signs of tingling or numbness along that side. And so just thinking about intervention strategies. So for edema, treatment is going to typically include active and passive range of motion, elevation, compression, retrograde massages, and splinting. And so this is typically to allow for strengthening of the hand muscles and restoration of local circulation to the median nerve. And then for pain treatment, typically we're gonna do some activity modifications and just look at the ergonomics of your workplace. And this is just to avoid the repetitiveness of your work tasks and poor posture. And so this is designed to limit postural stress on the hand and wrist. And then finally, for the treatment of paresthesia, which is numbness and tingling that occurs at night. I know you've been having some problems with that.
It's worse at night, that's for sure.
Yeah, okay, so treatment for that is typically going to be sensory re-education and tendon gliding exercises. And you can also use splints if you find that it's worsening. And so that's just to ensure natural position when sleeping, and some exercises to improve symptoms, and also just to allow for fine motor control of those affected digits. And so we're kind of thinking length of therapy for occupational therapy is going to be twice a week for about 1 hour each session, and we'll do this for about 7 weeks, or kind of depending on how your progress is.
Okay, that sounds good.
Awesome. Well, thank you for meeting with me today. Let me know if you have any questions. Feel free to give us a call. But I'm going to be getting the other OT, and he's going to go over some exercises with you. Does that sound good?
Yeah.
Awesome. Well, thank you.
I'm Alex. I'm your OT
Hi.
today.
Nice to meet you. I'm Allie.
It sounds like you've been experiencing some pain in your wrist area.
Yes, and my fingers have been feeling really numb and tingly, especially at night or when I'm talking on the phone.
Okay, can you point exactly where you're having some of that pain?
Yeah, a lot in my thumb and my pointer finger, and then sometimes a little bit in my middle finger, but on this side.
Sure. Okay. So what I'm going to do is we're going to do a little test. I kind of have a feeling that it is your median nerve, so carpal tunnel. So yeah, I'm just going to do a little test. So if you could rest your arm here for me. I'm going to do a series of light taps on the anterior part of your forearm. And just kind of tell me if you feel an increase in pain or numbness and tingling while I'm going through this, okay? All right.
Okay, it hurts right there.
Right here?
Yep.
Okay. All right, so based on the Tennell's test, you were kind of experiencing pain right here at your wrist. And so what we're going to do is we're going to first make you a splint that you're going to be wearing when you're at work, as well as when you're at home before you go to bed. You can put that on, so you're wearing it while you sleep.
Okay.
And you're going to be wearing this for 4 to 6 weeks. You're going to be coming in and seeing me on a weekly basis, so we'll kind of assess as we go.
Okay.
And in addition to that, you're going to want to maintain good posture, and it'd be great if you could decrease kind of some of those repetitive movements.
Okay.
You might catch yourself doing repetitive movements at work or at home with your activities of daily living. But yeah, if you could avoid that, that would be greatly beneficial.
And you mean like just repetitive movements of like my wrist, correct? Like typing and...
Yep, exactly.
Okay.
And I understand that you work on a computer all day for work?
Yes, I do a lot of typing.
Okay, and so when you're working on the computer, it's going to be really important to kind of maintain a neutral position between your forearm and your hand. So you don't want your wrist cocked back too much, or you don't want it flexed too much. So if you could kind of just keep your hand and forearm in line, that would also be beneficial for you. And then if it's really bothering you too, maybe use your opposite hand I know you're right-handed, but you could try out using the left-handed mouse. And say you're in the office and you have to go, pick up papers or something else from a coworker. It might just be beneficial if you use two hands instead of using your dominant hand. It'll put a little less strain on your wrist and the median nerve, and just kind of help out the carpal tunnel. And then thinking about stuff at home, maybe make simple meals, nothing too complex, nothing where you're mixing anything too hard or flipping a bunch of pancakes or something. And then kind of considering your morning routine, you're brushing your hair or brushing your teeth, to kind of try to maintain that neutral position, or again, maybe try to use your opposite hand.
Okay.
All right. And it's also important for you not to ignore signs of pain or numbness and tingling. And if your symptoms worsen, we just want you to stop whatever you're doing. Either, give us a call and let us know kind of what happened.
Okay.
And then as far as like daytime activities, like I said, stop if something's bothering you. And then it might also help you if you put an ice pack or something cool on your wrist. That'll help the pain there. And it's important not to smoke. Are you a smoker by chance? No.
Nope.
Okay, we don't have to worry about that then. And then you also should be aware of dropping objects. You might experience weakness in your hand or your wrist during those daily activities. So something just to kind of look out for, especially at the end of the day when your hand and wrist are getting a little bit more tired. Beware of muscle weakness and loss of finger dexterity. Again, that might be more prevalent later in the day for you. All right, and I'm going to have some specific exercises for you to do while you're at home. The first one we're going to do is called wrist extension. And so I'm going to have you put your arm out straight like this, and then very gently pull back the top of your fingers towards your body. All right, so you're going to hold this for 15 seconds, and you're going to do this 5 times, and you'll do this whole thing 4 times a day.
Okay, I can do that.
And then so we're going to do the same thing with wrist flexion. Now you can stick your hand out in front of you, and we're going to do wrist flexion. So palm down, and then pull your fingers back towards you gently. And then again, we're going to be doing this for 15 seconds. And you're going to do this 5 times, and that will also be an everyday thing for you.
Okay.
We're going to do the median nerve glide.
Okay.
And so you're going to make a fist. Keep your thumb outside of the fist. You're going to extend the fingers, keeping the thumb close.
Okay.
And then I'm going to have you extend the wrist slightly. Keep your fingers in wrist position and extend the thumb. So bring your thumb out to the side like so. Keep fingers, wrist, and thumb extended, and use your other hand to gently stretch the thumb.
Okay, I can feel that.
Okay, good. And you'll do 10 to 15 reps of this every day.
Okay. Yep, that's doable.
Next up, we have 2 different kinds of tendon glides. And so the first one, I'm going to have you put your arm on the table like this. And then you're going to bend your fingers, keeping your thumb pointing up straight. And you're going to make a tight fist like this. You're going to do 5 to 10 reps of this, and you're going to do that 2 to 3 times a day.
Okay.
Does that make sense?
Yep.
All right, and then the second tendon glide I'm going to have you do is going to be like this. So you'll point your fingers and your thumb up, and then you will bend your fingers like this, and then curl them into your palm, and then we'll just continue to repeat that.
Okay.
So extend your fingers, bend your fingers, and then curl them into your palm.
Okay.
And then again, you'll do that 5 to 10 reps, 2 to 3 times a day.
Okay.
And so I'm going to give this to you.
Okay.
As just kind of a little reminder. Again, if you have any confusion with that, just give us a call or email us, and we will gladly help you.
Okay, thank you.
You're very welcome. Take care.